Welcome back to series 61 of Staying Healthy During COVID Epidemic. No, pandemic really. Expectation during summertime and coming winter. What is going to happen based on the knowledge we have today? In North America and Europe, the spread of COVID 19 will gradually reduce with the increased temperature and humidity comes with the summer. The higher temperature and humidity retard the growth and spread of COVID 19. We know that for a while. However, this reduction of incidence, especially in heavily affected states like in New York and New Jersey, has anything to do with the healthcare or medical intervention, so as in other countries, especially for despite the claims of tropical countries, their control is due to healthcare, better management, and the curfews and etc., which absolutely not true. It is in part due to warm and humid weather and developing herd immunity, as in New York and New Jersey, in those epicenters of COVID in these states. Similar episodes are happening currently in Europe. Certain cities are actually numbers are going down because of the achieving the herd immunity. Once they reach 60 to 70% of the public has immunity against or antibody against COVID-19. It's a natural phenomena. So, however, this is going to get complicated due to second wave of COVID, which is on the horizon as a reinfection coming from China and indeed from travelers from Latin America now is getting hard hit because of the winter time in the southern hemisphere. With different strain or the same COVID-19 species during this midsummer, it can again re-emerge if authorities are not careful in having a real-time vigilance and surveillance program. However, with the temperature going to get cold again and dry during the November-December period, a third peak of COVID is likely to emerge in the northern regions again. And these countries must be prepared to handle that. Not through expensive and harmful vaccines, but by immunization, herd immunity, and get the people to develop the herd immunity through vitamin D sufficiency in every person living in this country, so that the incidence will be low and there won't be death, or maybe at least there will be very very few deaths if you prepare properly the people to face these second and third waves of the pandemic. In tropical countries, likely to get the second peak of COVID-19 in July to August this year, but may not the peak necessarily in early 2021. Nevertheless, the local outbreaks are likely to happen with the tourists and visitors coming back, or the people coming back to their own countries, bringing the viruses back with them. Because of the warm weather, relatively lighter skin color compared to Africans, again using the Fitzpatrick skin color scale, and in excess of 300 days of sunshine result in lower prevalence of vitamin D deficiency in those who are living in tropical countries, as in Southeast Asia, which is a great advantage of fighting against COVID-19. Consequently, people in these regions, the immune systems are better equipped than the winter time in the colder climates. That leads to lesser prevalence, incidence, and severity of the disease, and much less mortality from COVID-19, whether there are the restriction or healthcare activities to prevent irrespectively. So what are the negative effects of prolonged lockdown and curfews we witness in many countries, especially in Sri Lanka and Indonesia and a handful of other countries, which carry out purposeless and harming a lot of people. Major negative clinical outcomes are expected in all countries that exposed or imposed a prolonged severe restriction and curfew that went for months at a time due to poor understanding of the biology of COVID-19. They had no added benefit compared to those countries that had a strategic local restriction in the local districts alone and never had a shut down the entire country and the economy, harming more than 2/3 of the people in the country and their livelihood. It is estimated that for each reported COVID death, there could be unaccountable 1,000 community-related deaths from COVID in months to come. The latter is a complex process that includes but not limited to lack of access to essential medical and medication during the curfew times, but also inability to get timely medical attention, postponing surgeries due to more complications, starvation-related deaths, isolation of the elderly and the disabled leading to depression, post-traumatic stress syndrome, and indeed the markedly high suicidal rates. Also, neglect, illegal alcohol abuse, curfew-related brutalities, murders, and cumulative psychological stresses, social isolation, and peaks of suicide in different parts of the country related to economic failures and associated inability to support families, payments, etc. These COVID-related deaths must be included in the total COVID death statistics, as few countries have already undertaken quite rightly. By doing so, for example, in Sri Lanka, the total deaths related to COVID are likely to exceed 15,000 before the end of the year. So, next video I'm going to talk about the controlling secondary peaks of COVID-19 and explore whether the medical care make any difference for the prevalence of COVID-19. Till then, thank you, and don't forget to subscribe. Press the subscribe button. Till then, bye.